All right, we're looking at a cross-section of the spinal cord, and the first thing that we have to do is differentiate between the gray matter, which is in the central portion of the spinal cord, and the white matter, which is on the outside of the spinal cord. When you look at the gray matter, and you can see in this view down here, it tends to look like wings of a butterfly. So the first thing that you have to do once you are focused on the gray matter is to determine which side is anterior and which side is posterior. So when you look at these wings of the butterfly, the surface that the wings come closest to is the dorsal or posterior side. So you can see that on this side, which is posterior or dorsal, those wings of the butterfly come very close to touching the edge of the spinal cord, or they will actually touch the edge of the spinal cord. Notice on the anterior or ventral side down here, they don't come anywhere near close to touching. So this side is anterior or ventral, this side is posterior or dorsal. Once we know that, we can name the different horns of the gray matter. So the part of the wing, or this portion of the gray matter that comes up in this direction, is the dorsal horn. In the opposite direction, we have the ventral horn of the gray matter, and coming out toward the side, we have the lateral horn. You can see this on the other side too. So dorsal horn, anterior horn or ventral horn, and then lateral horn right here. We are also going to have a connection between the two wings, or the two sides of the gray matter, that is called the gray commissure. And there is a central hole that allows cerebrospinal fluid to flow through. You can see that in the diagram down here, and that is called the central canal. Let's take a look. Coming off of the dorsal side, we are going to have nerve roots, which eventually form spinal nerves. And you can see this enlargement right here. So this is, it almost looks like a ballooned up area on the dorsal side of the spinal cord as you're forming the spinal nerve. This is called the dorsal root ganglion. You can see that on either side. Okay, let's go to the white matter. The white matter you can especially see in the diagram down here. It might be a little bit difficult when you're looking at this three-dimensional structure up on top here. There is a division between the right and left side of the spinal cord, both on the posterior side and the anterior side. If you're looking at the anterior side, that division is called the anterior median fissure. And if you're looking at the posterior side, that division is called the posterior median sulcus. Now, a lot of people can have issues with, which one is the fissure, which one is the sulcus. Just remember for the posterior side, PMS, posterior median sulcus, and then you'll remember that that one is the sulcus, and the anterior side has the fissure. You can't really forget PMS, so that's an easy one. Okay, these areas of white matter are called columns, or you can call them funiculi, and each one is a funiculus. If you're on the posterior side, this is the posterior funiculus or posterior column. If you're on the anterior area, that is the anterior column or anterior funiculus. And if you are moving off laterally, that would be the lateral column or the lateral funiculus. Also, the area where the white matter comes together is called the white commissure.